Thank you, Kai, and thank you, STA, for putting together a wonderful panel here. I'm going to be talking about blockchain and anesthesia. First, I'm going to go over a little bit about blockchain and where it's been as a technology and some of the shortcomings as well as some of the potential in blockchain. And then I'll talk about a few products that are out there utilizing blockchain technology within the healthcare space. So first question I have for people is, how many people out there are familiar with blockchain? Let's just show our hands. Okay, so about half of you. And then how many have heard the words smart contract? Okay, a little less. All right. And how many know about smart ledgers? Okay, a few. So we got a few people familiar. But most people, those are some of the basic terms, and I'll go over some of those with everyone. First I want to show is picking up on where Kai left off around the hype curve. This is the Gartner hype curve from 2013. And on here, you don't even have blockchain or cryptocurrencies, not even on the radar. This is 2013. The original technology around blockchain came about after the financial crash of 2008, so around 2009. And so it was starting to be used around this time, but it wasn't quite on people's radar. If I go to the next one, this is in 2014. Oh, good, we have a mouse here. And what we see is that cryptocurrencies have now made the hype curve, and they're around the peak of inflated expectations. So already it's kind of bypassed the innovation trigger, and people in 2014 are getting very excited about this. Then if we go to 2015, we seem to be around the same place. Here we are, cryptocurrencies. And again, in 2016, it seems to have gone backwards into blockchain. So this kind of gives you a little bit of a historical context around the Gartner curve and what they're projecting on. And they say that it's 5 to 10 years for mainstream adoption in 2014. But you'll see in 2017, we're still in the same ballpark over here. Where is it? Blockchain has made it down here. And then 2018 hasn't really progressed much. So why is that? What's going on? Why is it kind of still all this expectation? And part of this is because there's a lot of excitement built up in the financial industry around blockchain, around fintech, but also that the technology itself is not quite mature, and it's not quite ready for prime time. And I'll go over some of the hurdles and some of the path forward. And so here's another peek into how much the hype around blockchain played into this kind of expectations around it. And you have Bitcoin having gone up so much in such a quick period of time and still worth something. Now, one thing to note is the Bitcoin technology and blockchain technology uses this operation called mining in order to create hashes. And so it takes quite a lot of computational power in order to create these cryptocurrency hashes. And they say that the amount of computing power that it takes to create one of these for it to be economically feasible for you to do that is around, I think the last numbers I saw was around $2,000 to $3,000 is how much Bitcoin would have to be paying you per hash awarded. So basically, it's in the area of generating a return, but only just barely getting there. And so a little bit more detail, since there's quite a few people that are not familiar with blockchain, a little more detail on how the technology works. And so basically, what you have is a transaction-related network, and it's a distributed network. And what you have is, and this is from BlockGeeks, which is a great website that does some great tutorials. And what you have is a peer-to-peer network consisting of nodes. And those nodes all have a way to validate transactions about users. Okay, and so when someone goes to create a new transaction, the nodes all have a record of the prior transactions and are using that in order to verify what's going on. And that's what makes it more secure, is this idea that the transaction, the history of every transaction is in the ledger that every node, that all the nodes have. And so they're able to verify it against each other in a decentralized manner. There's a few things that make that even more secure. One is that there's a fingerprint. The hash has a cryptographic fingerprint with each hash. And so that generating that is what takes a lot of the computational power and what makes it also very difficult to hack. There's also a consensus protocol, and that's a shared agreement of history between the different nodes, and so that they have a way to verify that every single transaction on that node, every single transaction in that ledger has been the same that's seen throughout the network. And so this way, they're verifying each other in a decentralized manner. Is there a little feedback? Is okay? All right. And so what makes this hard to hack is that if you change the ledger retroactively, you need to calculate a new hash for each block. In order to do that, you got to be faster than all of the computers that are on the network together. And since it's a decentralized network, it makes it very difficult for you to be able to do that. But there are ways that this has been broken. And Ethereum actually was one of the ones that was broken. And so there's third-party apps. So the network itself is quite strong. When the networks interact with third-party apps, with your wallets, where you're securing information, other information that's not on the network, that's where things start to get a little bit fuzzy, and you're able to get into the hacks. So one example was the hot wallets. And so these were wallets that were apps on people's phones that were storing keys, cryptographic keys, and they were supposedly supposed to be disconnected from the internet and supposed to be cold so they wouldn't interact with the network at all. But there was hackers that were found ways to make them connected, and CoinCheck, which was one of the cryptographic wallets out there, had $500 million stolen from it through that type of hack. And so it's one of those third-party app with a wallet talking to the network. That's where the vulnerabilities start to get introduced. And some of these were unforeseen, such as Ethereum. Ethereum is the blockchain that is allowing people to create apps on the blockchain and not have to create their own. And so it's more efficient and it's easier to build on, and that's getting a lot of traction in the computer programming community. However, Ethereum was also hacked, and it was hacked on the order of $80 million when the smart contracts were fooled into not seeing that they were connected. There was an unforeseen quirk in the actual software itself. And so, like I said, there's maturity that needs to be done with the technology in order to get to a place where we can feel comfortable using it in the healthcare setting. And so a little on smart contracts and how this will actually be useful, so getting back to. So a smart contract is basically, this is where IoT meets up with blockchain. And this is where a lot of healthcare is actually, I think, is going to be the first place to go, because this is the supply chain use cases and your drug supply use cases, your product supply use cases, your device supply use cases, where workers come in and they have a ID or a verification process where they verify what they're going to do with the network, and that kicks off a series of transactions that are tracking what is actually being done. And so in this case, we have a worker grabbing some equipment. They're scanning when they get the package. Then they're taking the package to delivery, and then when they deliver it, they're scanning again, and both of those are added to your ledger. And so that way, you have a transaction that's taking place through the supply chain that's adding to a distributed verified ledger. And so there's a lot of companies out there that are putting together use cases and putting together products around the use of blockchain in the supply chain. Now, when we come to health, there's a number of use cases in health that are being explored. I wouldn't say that they're quite ready for prime time, but a number are being explored, and they're being explored, like I said, around the supply chain. They're being explored around the payments between insurance companies and hospitals, and around the use of a digital health profile. And so the digital health profile being your unique identifier, that's your node that's your ID on the network itself. And then as things happen to you throughout the healthcare cycle, throughout your visits, throughout your lab tests, they get added to your profile. And then those are verified throughout the network between the providers and between the payers and between the hospitals. But again, like I said, there's these potential areas where the network is not as secure, where the need to verify people's identity and the ability to hack in those areas are still there. And so HIMSS had a nice set of use cases for healthcare, and they broke it down into these 4 areas. And one they talk about is digital identity management. And so that's managing your identity between patients, providers, and research subjects, having unique device identification, and also around drug IDs. And so we could see this implemented in pharmacy, around the use of tracking controlled substances, around the use of pharmacy management and utilizing drug databases, and also a record of use of the drugs between providers and which patient it's been prescribed to. Other areas include financial and insurance records, where you're verifying IDs for payments of services. And then still other ones, we're talking about clinical research and data access. And so there's a few companies, and one I'll talk about are building the kind of personalized health record on the blockchain and allowing you to control which pharmaceutical companies, which genomics companies, which research companies have access to your data, and then enabling payments through that by allowing them to have access to your data. There's quite a few of these companies out there, and this is a nice map from the website. I think it was on a GitHub repo. And a few of these I'm going to go over now and talk about in the last few minutes that I have here. One is an interesting one called Neuromesh. That's this guy's over here in the med device and IoT security. And so they're utilizing a small, what they call a vaccine in IoT devices. And so they're basically creating these small apps that go on in your supply chain and allow for the verification throughout your supply chain. This is kind of interesting. The Block Pharma is a group in France, and they're doing trying to improve traceability within the pharmaceutical supply chain, and also reduce drug counterfeiting in drug supplies. Doc AI, full disclosure, I'm a clinical informatics fellow, and one of my fellows who graduated last year works at Doc AI, and they're looking at platform-based analytics, and they're utilizing blockchain for management of personal health data. Ubase is another one out there that's over in which group here. Ubase also has blockchain as a data container, and so they're utilizing, I'm getting the warning here, a data container for having your personal health record information in genetic data, your immunization status, your labs all together. And what they're doing that is making the patients the custodian of that data, and then allowing it in a wallet and allowing for access and control of the granularity of the access between providers. And the reason why the blockchain's use in this is around authentication and security, and they're seeing that as a potential benefit. There's a few more here, which I'll skip through. One of the, to get a little more granular, this is from one of my mentees, Priya Ramaswamy. She created this for the STA competition last year around blockchain. And she was talking about how use of the blockchain can be used to query and find IDs. So if a patient comes in, his name's Jim, he's got 2 IDs within your healthcare system, or there's 2 potential same names, that if you have Jim has a control over, say, one of the devices, one of the applications he's using before, to push his ID to the hospital, then the hospital can use that in order to use the blockchain to verify his ID. And that's kind of the idea behind the use of blockchain around ID management. Like I said, there was a number of areas that I alluded to before around hacking, around areas that can be exploited with blockchain. I'm just going to go to a few of the hurdles in my last minute here. There was 4 hurdles that are seen as blocking the wider use of blockchain and stuff that we'll need to get over before we can actually see it implemented in a wider manner. Those include the interaction, the interoperability. So you saw earlier that there's all of these apps being built, there's all these blockchains being built. They don't necessarily all talk with each other. And so some are built on Ethereum, some are built on their own. So there's a lot of talk within the community around consensus mechanisms between different blockchain solutions. Another thing is the cost of implementation, as well as the transaction cost around computation and generating the blocks and generating your hashes are quite computationally intense. And so that's another potential. But the third one I think is important too, is that because it's such a new technology, the regulations aren't that mature in the area, and so that's holding back, and that's actually holding back a lot of the fintech as well from going more into this, and as well as privacy. And so, like I alluded to before, there was hacks done around wallets. And so you have these third-party apps where you're supposed to be storing data that's not part of the blockchain, but connected to your unique ID. And when that link there is the most insecure link right now in blockchain technology. And so with healthcare data, you don't want all of your genomic data and all of your personal health information all projected throughout the network. You want to have that in a secure area where your ID is connected to the network. And so I see my time is up here. And that's about it. Okay, we'll save questions for the end. Thank you.